It's not often that one aesthetic procedure can give you twice the benefit, but that is exactly what Smartlipo can do for you. And it starts by melting away those stubborn pockets of fat. So we have Dr. Stubbs, known as a beauty coach, here to show us how it works. Hi, Dr. Ann.
Nice to be here.
All right, so Smartlipo, what is that? The difference between that and liposuction?
Basically, Smartlipo is with a laser. So we numb up a certain area. The patient's largely awake. We don't put them under general anesthesia, which is kind of a nice thing. An area can be numbed with local anesthetic, and then a tiny little laser beam is inserted right underneath the skin, and it melts the fat under the area. It does two things. It melts the fat cells so that we can suction them out as a liquid, and it gives us a nice kind of smooth result. And then it also tightens the tissue over top, meaning it heats the underside of the skin, and the skin tends to tighten down.
I think when people hear the word lipo, they think of the invasive kind of liposuction, right? You see that video of that, and it kind of gives you a different mental picture. We're going to look at some Smartlipo and see the difference. Exactly. And this is not nearly as invasive.
Right, and you see that's a tiny, tiny little laser fiber. It looks like almost like a piece of spaghetti on the end of it. That's how thin it is. And you can see kind of right under the skin there was a little bit of light, and that's the laser beam melting the fat. And as I mentioned before, no need for general anesthesia. Traditional lipo tends to kind of rough up that fat layer, and we suction it out, and for lack of a better term, in kind of almost chunks. And that's because something that people feel like, okay, that might leave me a little bit lumpy, that might be a little bit aggressive. This is a much gentler procedure. It's a tiny little, like I said, the size of a strand of spaghetti, and basically we just melt the fat with this laser, and then we suction it out with an equally small little tube that goes right under the skin, a little catheter that suctions that fat out, so it's gone that day of the procedure.
So what's the recovery like in Smartlipo?
Usually we put people in a compression garment for about 2 weeks. We tell them they're going to kind of have some drainage from little areas where the little tiny pinholes where we went in. They'll drain for maybe the next anywhere from 8 to 24 hours, and they'll be in a compression garment for 2 weeks. We say don't work out for 2 weeks. We don't want them doing anything too vigorous for about 2 weeks. Daily activities are fine. Driving the next day should be fine. People largely go back to work in a day or two. They might be a little sore in the area, and we do lots of different areas. Our most common area is kind of belly and love handles, right around the middle. Everybody wants that gone. We can do arms, we can do inner thighs, outer thighs, and we do a lot of knees too. Who thought? And then we can do that right under the chin too.
So after you wear that compression garment, are you going to notice those results pretty much immediately? Does it take some time?
Actually, you'll notice results absolutely immediately. A lot of people even go down a pant size or two the week or two after the surgery. You're a little puffy just from the anesthetic and kind of that going away. And those results tend to get better over the next 3 to 6 months because the collagen builds in the skin from that heat we put in there, and the skin tends to tighten.
And that's the thing, we talked about that with twice the benefits. I mean, that's a huge difference for a lot of people because not every procedure does that tightening.
Exactly, and so and it is based on people's age and how much collagen they're still building. You know, folks in their 30s and 40s build a little more than maybe people in their 60s and 70s, but even we've done people as old as 80 years old with Smartlipo, and they get wonderful results.
So is this a case where an ideal candidate could be anybody looking to lose some actual inches? I mean, because these have great results.
It has fantastic results for people who kind of, we've even had people who say, I just want to jump start. I feel like I can't get in the gym with all this around the middle. You know, if they lose a few inches right around the whole midsection, they're much more likely to get in their workout clothes and go for a walk or go to the gym.
Isn't that funny? A little pre-confidence before you get in there.
Exactly.
All right, and it's always a good idea we talk about to start with a consultation in any case and see if this is a good procedure, maybe there's another one that's better. You have a great offer though if you do choose to do Smartlipo.
Right, we're doing 20% off our Smartlipo surgeries, and daytime viewers just have to mention that they saw you here on daytime, mention that, and then we go ahead and apply that to the price. We individually price everything. So people always ask me, what does that cost? And really, I can't say that without seeing somebody, doing a medical history. We tell you whether or not you're a good candidate for this. People who can't do it are pretty much type 1 diabetics, or people on blood thinners, or people with a lot of other medical problems. And those are folks that we can refer for cool sculpting or ThermiSmooth or some other non-invasive modalities that really do get rid of the fat as well. But Smartlipo is wonderful for healthy folks who can sustain an office procedure in and out in 2 to 2.5 hours with a big result.
Okay, perfect. Dr. Ann, as always, thanks for being here.
Thanks for having me.